Right. Today we will discuss another X-ray, and that is of asbestosis exposure. So, when a patient comes to you and having a history of asbestosis exposure, how you will see or how you will confirm that patient is having a asbestosis exposure? Right. Then I will give you a abnormality that will be a classical for asbestosis exposure. Whenever you see that abnormality, you can make a diagnosis of asbestosis exposure. Or simply, if a person give a history, for example, with shortness of breath and he's having a 70-year age, and he presented to you in OPD case, and when you have his X-ray and you see the abnormality that I will mention today in this lecture, you can easily diagnose and you can easily guess. So, how you can see abnormality of asbestosis exposure in this X-ray? I give you 5 seconds. So first you can test yourself whether you can diagnose or spot abnormality in this X-ray. After 5 seconds, I will mark with my pointer that where is that abnormality. Right. So this is the abnormality over here. You can see the calcified white plaque. I am encircling. This one is also calcified plaque. And this one white calcified plaque. This one also I am encircling with my pointer. So these are the pleural plaques. So whenever there is pleural plaque, is 99% that patient has been exposed to asbestos, right? So these are the classic signs, and this is the classic chest X-ray of a patient who has been exposed to asbestosis. So remember, always have a, it's very important, always ask about the person work history. You can correlate a patient chest x-ray with his clinical finding, and he simply you can guess the diagnosis or you can reach to the diagnosis. Same like this patient, he has asbestosis exposure. So these are the pleural plaques, the calcified pleural plaques. These are the pathogenomic, the classic for asbestosis exposure. You can easily diagnose.